It's been said that we are the sum total of our past experiences, and though we don't have to forever be defined by our past, the statement is nonetheless true. The season of childhood is a particularly vulnerable time, and what happens to us between the ages of birth to 18 has long and deep consequences in who we become. The reality is that children face adversity regardless of our best efforts to protect them, and things happen that are often outside of our control. Adverse childhood experiences, referred to as ACEs, describe traumatic experiences that can have lasting effects into adulthood. And learning about one's ACEs can equip us to better care for our children and their needs, as well as inform us to care that can be made possible for adults with ACEs. Here on our show today to discuss with us the ACEs and her work with the ACE Resource Network is Sarah Marikos. Welcome to Behavioral Health Today. I'm your host, Dr. Graham Taylor, and I'm excited to have Sarah with us on the show. Sarah is an epidemiologist with a background in public health and an understanding of health inequities at their root causes. As the executive director of the ACE Resource Network, Sarah led the launch of numberstory.org, the first national public awareness and education campaign on adverse childhood experiences, the ACEs, childhood trauma, and other forms of childhood adversity that increase the risk for poor health outcomes and educational challenges. Sarah has a master's in public health and epidemiology from San Diego State University, 2 bachelor's degrees in interdisciplinary studies and geography from the University of Berkeley, and is also the Human Impact Partners Health Equity Fellow. Sarah, welcome to our show. So nice to have you here.
It's wonderful to be here. Thank you for having me.
Well, I would love our listeners to get to know you. And if you could take a couple of minutes and just give us your story and what brought you in to working with the ACEs.
Yeah, thank you for the question. There's a lot of things that brought me to this work. I, as a child, was and as a teenager, really impacted by the mental health challenges of people around me, of struggles with addiction, people around me and in my community. And I, because of where I lived and the different schools that I went to, really saw the impact of violence in different neighborhoods and communities. And I really wanted to understand all those things. I wanted to understand why people and friends and loved ones were struggling in ways that that others weren't. And what I learned is that a lot of these challenges from mental health, the substance use issues, seem to stem from my loved ones' early experiences, their childhood experiences. And me, myself, I have an older half brother who's 15 years older than I am, and I have a younger brother who's 5 years younger than I am. And we all had, somewhat different childhood experiences. And I just that I was observing as we were all growing up, the impact of that. And I really deeply wanted to understand it. So this is also the early 2000s, the opioid epidemic is starting to take off, and I'm observing the impact in some neighborhoods and not others. So I decided I wanted to I wanted to be a doctor. I wanted to help people and understand these things better. And then through different experiences and through school, learned about public health and started to study public health, and was really struck by the inequities that we see across communities and some of our biggest public health challenges. And I learned about all these big public health challenges, from diabetes to cancer to heart disease to depression, and spent all this time talking about them and learning about them. And then I learned about the ACEs study, and it had like this it was mentioned 10 minutes, the last class of the semester. And I learned about this study, and I said, why didn't we learn about this first? And that really is what brought me into the work that I'm doing now, and why I care so much about spreading awareness around adverse childhood experiences, or ACEs.
What I really admire about that is it's so easy for us to get focused on behaviors or, people making decisions. And it's so easy to become judgmental and say, well, if they would only,
Yeah.
But what you're doing in that is you're kind of going deeper, and you're willing to suspend your judgment, or suspend, whatever it may be that you could attribute to what they're doing, and become curious and start maybe asking what and how, or why are these decisions, behaviors being done? And that behavior, the decision, those are just a symptom of something deeper. And what I love about the ACEs is that you're redirecting our attention to, in a very necessary way, that there is a meaning behind the things we do, the thoughts we have, the behaviors we choose, the decisions we make. We're going to get into that in just a little bit, but share with us, how common are adverse childhood experiences? What's the research showing us?
Yeah. So about 2 out of 3 US adults have experienced at least one adverse childhood experience. And I want to take a moment here to define what that means.
Okay.
So in the mid-1990s, the CDC in Kaiser Permanente in San Diego conducted a study of over 17,000 adults. This was, adults who had health insurance in the mid-90s, middle and upper class, mostly college educated. And they asked these 17,000 adults about 10 different types of childhood experiences. And it included physical, emotional, and sexual abuse. It included emotional and physical neglect, and then household challenges that are pretty common, ranging from having a parent or caregiver with a mental health challenge as a kid, or substance use challenges, or a parent or caregiver being incarcerated, going to jail, witnessing domestic violence or intimate partner violence as a kid, or having your parents or caregivers get divorced or separated. And what they found, to come back to your question, is that these ACEs are incredibly common. They were incredibly common among these 17,000 adults. 2 out of 3 of them had at least one ACE, and 1 out of 6 adults have 4 or more ACEs. And this was an incredible finding, because previously there was, I think, a lot of the studies on early adversity or trauma had focused in specific, maybe more high-risk populations, and there hadn't been a look across a more general population of how common these things are. And they found that they were really, really common and really impactful.
They are impactful. What I appreciate about the ACEs, it is naming that these things are in fact significant, because we hear it all the time. It's almost like we become habituated to, or desensitized to, that, yeah, that was a difficult upbringing you had, or this was a difficult upbringing, or yeah, someone happened to do that in your family. And we often, in naming these events, we tend to just kind of either kind of normalize it. Well, yeah, everybody goes through something difficult, or maybe we even kind of dismiss the level of its significance. But this study is saying, yeah, no, don't do that. Don't just dismiss it, or just kind of normalize it, or undervalue it. Recognize the challenges around this. And we're going to talk a little bit more about that in the show. I also know, though, that there are some additional adverse effects, or adversities, let's put it that way, adversities that can contribute to adverse effects, in addition to the original 10, things like discrimination, poverty. Name a few of those for us as well, for folks to listen to and consider.
Yeah, and I think it's so important that you ask this question, because, well, the science of the ACEs study that has, again, started in the mid-1990s and has been repeated in lots of different populations in lots of different places, and continues to show how common and consequential they can be. There's lots of other research, and has been for decades, about other things like poverty, and how that can affect, growing up in poverty can impact a child in very real ways, from health to educational to other opportunities. Racism can have a similar impact as the original 10 ACEs in causing that toxic stress response that can lead to a lot of the negative outcomes as a child as well as an adult. And then other violence, experiencing community violence. Again, sort of, you can start to see these themes here with the original 10 ACEs and some of these other experiences that are unfortunately very common for children, that they are, stressful, potentially traumatic experiences that, when they happen when we're young and our brains and our bodies are developing, can really impact how our brains and bodies develop in response to our environments and our experiences. So when our experiences and environments are, threatening or not safe, and it happens at these critical moments of development, they can really change. And you mentioned it earlier, and I'm so happy you did, because a lot of people can be like, they can understand how they may change how we feel, which is very true. And that's very important, but it can also change how we function, that how our biology, and we can go into that. But I think that's an incredibly important component here, because it helps us move from, and Oprah Winfrey and Dr. Bruce Perry published a book by this title, from, what's wrong with you to what happened to you.
I love that. Yeah, I really appreciate that. I would love to have you back sometime and talk about the brain development around this, because there are neural pathways that literally get created that are trauma driven, deeply furrowed, deep pathways that automatically take us down that path to, at their very best, protect us and to serve us in some function. But not everything is a trauma that we're always responding. Sometimes it's a false alarm, but we still respond to it as it being real. Maybe we can flag that and find another time to come back and talk about that, because this is so real and so impactful. It's not a choice. These are things that actually happen. And these additional adversities you're talking about, discrimination, poverty, racism, other violence, separation, big changes that might happen in someone's life, like immigration, or someone being a refugee or seeking a new area to live, or separating from someone important to you, bereavement, survivorship, being a parentified child, being given all these responsibilities. These are all things, like you're saying, that are adversities that put a level of stress, sometimes toxic, on a child that really impacts not just their brain development, but everything from their behaviors to their feelings to their perceptions. Yeah. As you're talking about these things, there are some risk factors in terms of childhood experiences, things like maybe coming from a low-income family, like you mentioned. I'd like to build this out a little bit, but these are factors that can make a child more prone to having an adverse childhood experience. Name some of those for us, would you?
Yeah, that's a really important question. And like I said, that ACEs are common across, socio-demographic groups, rural, urban communities, and across cultures. We do see that some groups or populations are more likely to experience ACEs than others. And that's really important to understand, particularly if we are serious about improving the health in this country and reducing health disparities. So we see that groups with lower incomes are more likely to have a higher prevalence of ACEs. We see that adults who are unemployed or underemployed are more likely to have a higher prevalence of ACEs than people who are employed. We see that people with higher educational attainment have a lower prevalence of ACEs. And we see that most communities of color have a higher prevalence of ACEs. And I want to spend a little time talking about that, because the conditions due to historical racism and discrimination, as well as contemporary policies and structures that exist in this country, we see that communities of color are more likely to experience these things in a large part because of these structural factors that increase risk. And I know there was a guest on a previous show of yours who spoke a lot about intergenerational trauma, which is also really important to name, and the legacy of, how we can pass down our trauma to the next generation, whether that's through, modeled behaviors or whether that's through epigenetics. So I think if when in the work that we do at the ACE Resource Network, they're very attuned to these community level risk factors and focus a significant number of resources in places where people have a higher prevalence of ACEs and generally fewer resources or access to healing tools, resources, and spaces. because of some of those factors.
What's so cool about what you're doing, and we're going to get to the number story in just a minute, and how people we can, identify what our number is, and you'll expand upon that for us in a moment. However, first, what I really like about identifying what one's ACEs may be, it's not like, okay, I got a number and so what, or like I'm on a Myers-Briggs, I'm an IFTJ. It's not about that. It's something larger. In fact, what you're doing here is you're saying this is a number, but this allows us to do so much, including finding targeted ways to intervene, where to come in with, maybe, in our societies with low-income families, or with the educational level, or levels of family stress, or how the finances are. So it allows us to identify where the stressors occur and what factors make one more prone to being at risk for these things. I also want to highlight another thing. There are some things in there in the, the original 10, let's say, and some other ones too, but if there's physical and emotional, abuse, or there's substance abuse or domestic violence, those are something we might refer to as kind of big T traumas. Those are hard to miss. Those are pretty prevalent. Someone gets incarcerated, you can't miss that. Yeah. But there are also, we've talked about this before on our show, about little T traumas. I want to highlight this for our guests too, and I'd be curious about your thoughts. You can experience an ACE if you have a family that's not tight-knit, or maybe doesn't speak about feelings, or not very good at processing emotions together, or don't know how to navigate through difficult times. Maybe just kind of tuck it away, or try and ignore it, or avoid it. So that stays with you. That leaves you by yourself as a wee little guy or wee little gal to kind of process and navigate through some of those times. And that can be an ACE too, can't it?
Yeah, that's a great question. I mean, we can think about, what I first think about is, emotional neglect, right? When children don't receive that emotional support that they need to develop in a healthy way and thrive. Yes. But it to me, it comes back to, like, when children don't have that sense of safety or security, don't have that safe adult that they can go to help them process hard things, because hard things are going to happen. There's a lot of there's trauma we can prevent, and we should, and there's ways to do that, and there's ways we're working on that. But we also, children are going to face adversity, and what I think is really important in that, to be really clear about ACEs and toxic stress, is that sometimes people think, well, I've experienced ACEs, or my kid has experienced ACEs, and what do I do? It's happened. It's in the past, right? But the science, what's amazing about children and even adults, is that these things, these risk factors, these ACEs for some of these negative health outcomes, learning challenges in relationships, challenges in work, and we can talk about those, is that if children have safe, supportive adult relationships in their lives, that can help mitigate the impact of ACEs and prevent that toxic stress response. And so that these positive experiences that we want children to have are just as important, because it can help mitigate that impact, to help that child's stress response system, whether that's a big T trauma or a small T trauma, to say, you're okay, you're safe, we can process this in a healthy way, instead of what happens in many households, like you named, silence or refusal to name what's happening in front of us.
Yeah, I like what you said. And this is kind of a nice kind of headline. Did the child receive what they need to develop in a healthy way? Yeah. That's a powerful question. And from there, we can begin to, was it a safe environment? Was it an environment where they had support of others so they could, like you said, navigate through difficult times? And if they didn't have what they needed to develop in a healthy way. The good news is, we're going to come to in a few minutes, there's some hope around this, because we can build these things in and teach people how to do it. But if they don't get it, they may not even recognize it. Yeah, I didn't have anybody navigate or talk about these things. And there was no big trauma. I don't have any scars or ER visits, or no one got incarcerated. My folks weren't fighting, but I didn't get what I needed. So I'm walking out reactive to, maybe unknowingly, to things that I don't know how to navigate. And so maybe I avoid things, or maybe I come across angry at times. Little do I know why. So these things you're saying right here too, we might refer to as little T's, because they're not huge traumas, but they are traumatic nonetheless, because what you said, they didn't receive what they needed to develop in a healthy way. Love that.
Yeah, exactly. I just want to emphasize, because I think of all the people I've talked to and have had the privilege to get to know through this work, is that so many of us downplay what happened to us.
Yeah.
And I find that when we're in spaces where we can be honest and we can share and we feel safe, and name these things that really impacted us and do impact us, there's a lot of power in that, and that we can really begin to help us address some of the consequences of maybe these early experiences that are challenging us as adults.
One of the challenges is, though, that to talk about it, I've got to address what I've paired. This is the event. This is me as a child. And I've paired those, is that says something about me. Little do we recognize that at times. And that's the shame-based piece that you were suggesting earlier on. So to talk about it, it can be freeing, and I can depersonalize, and I can uncouple myself from that event.
Mm-hmm.
But my whole life has been through the identity of those things that have happened to me. And it is so hard to lean into. Oprah Winfrey's talked about this, to name her abuse. Her abuse was not her fault. We can all say that, but as a child, we think it is. Maybe there was something I did or something I could have avoided. Maybe there's something I, brought on. And so we have such a shame-based, self as responsible, accountable message around this, that it's very hard to talk about the very thing that can be freeing.
Exactly.
But that's where, if we can just begin to identify it, and then we can begin to help people decouple and say, this is not about you.
Yeah.
This is about something that happened, like you said, what happened to you, not what's the matter with you, what happened to you. So I really, really like that, and begins to explain maybe why some people find themselves doing things in life. So we know that there are consequences with those that experience, adverse effects, the toxic stress. They have difficulty, and cover this with us. They have difficulty at times, maybe forming closer relationships, or maybe trouble in their workplace. Name some of the consequences or outgrowth of those early ACEs going on in someone's life.
Yeah. So the more ACEs we experience, the more likely we are to experience over 40 different health conditions. And it ranges from heart disease to stroke to cancer, depression, anxiety, suicidality in children and adults, things that people don't really think about. And like maybe asthma, for example, people don't often think about the mechanisms behind that. Children who experience ACEs are more likely to experience certain like colds and viral infections, right? Because their immune systems are impacted.
So our emotional experiences, our emotional immune system gets worn down, and that affects our physical immune system, doesn't it? Our biological immune system. Absolutely.
Yeah. Our immune system, our metabolic systems, our cardiovascular, all these systems are impacted by these experiences. Again, we're developing in response to these experiences. And so that's why they're so important. Just as we're developing in response to those positive experiences, or maybe those neutral experiences we were sort of just talking about, where maybe we didn't experience a significant amount of adversity, but we didn't get a lot of love or support either. And all those, I mean, if there's one thing people can take away, these experiences can impact us for our entire lives. And like you've already named, there can be a lot of shame around them. And so that's why we launched the first national public awareness and education campaign on ACEs and toxic stress and hope and healing, because we believe that if you can understand these experiences, how they may have impacted you or your loved ones, you're empowered. Well, there may be shame and guilt around it, and that's really important to honor. But if we can have the language and understanding of it, then we're more empowered to be able to, forgive ourselves if that's what we need to do, support others, support our health, notice something about how we parent and how we may want to parent differently. And so the campaign is called The Story of Your Number. It's available at numberstory.org. And we believe it's a great way to begin to think about your early experiences that can empower people then to sort of take action on different levels for themselves and their loved ones, so that, you know, it doesn't impact their career. ACEs are associated with increased workplace absenteeism and challenges in the workplace. It's associated with people who experience more ACEs are more likely to see the world in a hopeless way. They assess the world differently because of those experiences. You know, and with significant numbers of ACEs see a shorter lifespan. So they're very real, and I haven't even talked about sort of the learning challenges children have who experience and are experiencing lots of early adversity, the really serious consequences. So with awareness, we can identify, we can intervene, we can do something about it. So that's why that awareness is a great first step.
Brene Brown talks about the antidote to shame is vulnerability. And what you're encouraging people with the ACEs is to kind of step outside of themselves just for a second, long enough to say, yeah, this was me. And yeah, that happened to me. And this was part of my upbringing. And yeah, that occurred too. 1 in 6 have 4 or more, you said. Yep. And when people begin to see what happened in my life and happened to me, and we begin to, maybe ideally as an adult, or maybe with some help or seeing our kids going through this, we get to help them see that it's not who you are, it's what happened to you. And I think that's the beginning of the uncoupling. So we begin to say, you mean the difficulty I have in getting close to my relationships is not because there's something fundamentally wrong with me, or the trouble I have holding a job, or difficult with my finances, or the depression that I might experience, or my tendency to act out and get angry quickly. You mean that's not who I am? And for the very first time, what you're doing, I think, so in such a lovely way, Sarah, is to allow people to say, what if it's not about you? Like you said, what if it happened to you?
Yeah.
That's freeing, isn't it?
It can be very freeing. You were a child and it was not your fault. Yeah. I think full stop there.
Full stop.
Yeah.
Yeah, you're also, and I appreciate this piece too, you're recognizing this has medical consequences for us too. We know that hundreds of billions of dollars each year are accounted for by these economic and social costs because of ACEs. In fact, it was projected that if we could just reduce ACEs by 10%, that would equate to a savings of about $56 billion. And from a medical perspective, the reducing of health conditions, if we could prevent the ACEs, it's estimated up to 1.9 million heart disease cases and 21 million depression cases could be avoided each year. That's 10%. That's amazing.
It's staggering. And that's why, you know, there was the study done by CDC around depression that we could reduce 44% of cases of depression. That's incredible when you think about how common depression is. And how, and in the context of the pandemic, and how depression and anxiety has increased significantly. And so I think sometimes people, when they look at this problem, they're like, well, how do we prevent? How do we intervene? It's going to be so expensive, right? These are such big problems. And they are. But we're paying for the consequences of these ACEs right now in our overtaxed, under-resourced mental health system. And so we need to look at this at pretty much from a systems level. How do we understand the impact of trauma, identify and intervene early? In families, how do we start to talk about these hard things? How do we shape our communities so people and children are supported? I think I just think one of the most critical conversations to be having right now, especially in light of the pandemic and the impact that has had on children and families, where we lost a lot of the things that really helped us, that social connection, isolate, we became more isolated. If we went to, ladies' night on Thursday, I go to, like, I lost that during the pandemic. And that was those stable relationships that kept me healthy. We lost so much of that, and children, lost a lot of that as well. And so I think it's one of the most important things we can be doing, and looking at how our communities are structured and the systems that serve people are structured so that we can really address this head on, because there are enormous costs in terms of morbidity, in terms of mortality, in terms of quality of life, and again, cost.
I hear that, and I get, a wave of hope that comes up. I mean, all children, each one of us, we live through different experiences at times, but with the right tools, we can learn from our experiences and become stronger. And ACEs are traumas, let's name this clearly though, that are more difficult to overcome, and that can have some lasting scars on the child. And as you've helped us see very clearly here, if left unrecognized and unaddressed, they can have really long-term consequences and ripple out into their lives daily, but also generationally. You're talking about the intergenerational part earlier on, which is a nice piece to bring in. Thank you for that. And however, you're also encouraging us to see that with prevention, or if necessary, early detection and early intervention, we can take some significant steps to mitigate the long-term consequences of untreated ACEs. And, life happens, and no one gets through childhood or life unscathed. But the good news is that in terms of helping our children through these adversities, this is so important. We got to get back to this as a nation. We've got to start this in the home. There's been a breakdown of the family. It's been a breakdown of our communities. And if we can start this in the home with parents and caregivers, like you're saying, helping kids navigate through these things, developing, resources and coping strategies and communication, ways to communicate, problem solve, right-size things. We can take these adverse experiences, right-size them. And I know that the ACEs Resource Network, you guys, have recently partnered with the American Society for the Positive Care of Children to produce an ACEs-informed toolkit for parents and caregivers for children 0 to 5. Tell us about that one, starting in the home, starting early on.
Exactly. Thank you for that question. I'm really proud of the work that we've done with American Society for the Positive Care of Children. They approached us several years ago because one of the things that they were continually asked about by parents and caregivers was ACEs. And what do I do about it? And, I experienced ACEs, and, my child has or is experiencing ACEs. And so they came to us and said, how do we talk to parents with young kids about this really hard thing where, again, parents may have guilt or shame that their child has ACEs, but they experienced ACEs themselves. So it was an incredible partnership. We launched this toolkit with them last year during Child Abuse Prevention Month, during April. And we said we want to educate and inform parents and caregivers about the impacts, even at a really young age, that the impact of early adversity of stress on infants.
Really good. Yes.
Infant mental health is a relatively new field for many of people, that these impacts can happen early, but there are things that we can do. Right. And what the ASPCC brought in was positive parenting. How can we, even if we weren't modeled positive parenting, how can we do that for our kids? And how can we support our kids through hard things to minimize the impact? So I'm really proud of the work. We, really wrote it for parents and caregivers, wanted it to be accessible and digestible, and provide a message of empowerment and hope, because that's what we really believe. And I've had the privilege to see through this work is how powerfully people can make changes in their lives that change the trajectory for themselves and their children. When they recognize that this isn't working and I want to do something differently.
Yeah, it's really good. So in many ways, we get to give our kids, those that we work with, maybe something that we didn't have. Now that we know what it is, how to come at it, this toolkit's wonderful. had a chance to do a little bit of looking at it when I was prepping for the show, and it's really pretty cool. You guys get to be proud of that, because that's really meeting a really wonderful need in a way that equips people, not just say, hey, talk to your kids about this. Well, how do you talk about it? No one ever talked to me. I do what I know, what was done to me, I pass on. And so I do what I know, but maybe maybe I could grow a little bit in that. And that's what you're encouraging here. I so appreciate, what you're sharing with us, and we're going to have you back at some point, but I know just given our time, we're going to need to kind of wind down today. As we do, would you give kind of a takeaway word to our listeners about the benefits of, understanding the very things we're talking about today, one's ACEs or the ACEs of those around us, and to explore this number, to get our number story and to right size it, but as well as appreciate maybe the number story of those around us. Give us kind of a takeaway word from our show today.
Yeah, and thank you for the opportunity to do that. I think one of the most powerful things that we can do for ourselves and for others is really to understand how these experiences may have impacted us. Yeah. And we have lots of tools for people to do that at numberstory.org, ranging from taking the ACEs quiz to lots of other resources. And then once we can better to understand it, we've also provided tools and resources for things that we can do for ourselves that are really important for us, particularly if we've experienced ACEs and toxic stress, like those healthy relationships in adulthood, like movement, like nutrition, like sleep, that are so critical to sort of mitigating the impact of the consequences of ACEs and toxic stress. We have resources. I encourage people, if there's someone that you're thinking about in your life, that may be impacted and maybe is hurting in some ways as a result of these experiences, educating yourself about it, being there, being willing to say something to support that person goes a long way. And that I've seen, again, how someone reaching out can make such a difference for a person. And so I think educating yourself and so that you feel comfortable to reach out and have whatever conversation you think needs to happen, because we've done a fair amount of research and we see that people want to support others who experience this. And as people understand it more deeply, there's increased empathy. So I just encourage every listener to go to numberstory.org, can follow us on Instagram and Facebook and Twitter at My Number Story. And what we work to do is educate, inform, tell stories of people's healing and resilience and what worked for them, because we believe as the more we hear other people's stories and what supported them in their journeys, something can resonate for us and we can adopt that into our own lives or the lives of our children.
That's really good. And you also put the links in there that are helpful. We're also going to put those on our site as well. But that's a wonderful takeaway message, to the listeners. ACEs are common. And if you're someone who's experienced something, you're not alone. And the feelings of the impact of the trauma can be felt years later, and you might only be coming to recognize them right now. We had a guy in our show, wonderful guy, Bill Parham, and he's a doc, and he's the head of the NBA's Player Association's mental health. And he was talking about all these wonderful, really elite athletes. And he says, Graham, there's a lot of GOATs, greatest of all time athletes. But he says, we have not seen yet a true GOAT. I'm like, what are you talking about? Look at Michael Jordan or some of the gymnasts that we see or some of the professional. He says, no, these are all people who've had extremely, if you learn their story, like what you're bringing attention to here, Sarah, if you learn their story, they have some pretty severe adverse childhood experiences that they've overcome. Imagine the energy put into overcoming those while achieving their potential athletically. And he's saying, what if we took care of those ACEs early on? Yeah. What if they didn't have to overcome those adversities because they had somebody navigate them with programs like what you're describing? Imagine the release of their potential athletically in this case, without those things having the energy drawn or holding those ACEs back while they reach their fullest, God-given gifts athletically. And it was a really eye-opening thing for me. And that's what you're encouraging here. If we can get in early, if parents can have toolkits, if we as educators and those working with folks can understand these and people begin to understand what these ACEs are really about, we can have some very different outcomes. So if you're going through something, folks listening or someone around you, find a trauma-related therapist who can help you through that time. Or if there's some physical effects that you think are linked that you're feeling medically, like Sarah's so nicely pointing out to us, find a healthcare provider and see what some of these things might be driven by in terms of some of the trauma that's gone on in your life. I was going back over Scott Peck's book, The Road Less Traveled. The opening line of his book, the very first sentence is, "Life is difficult." That's the first sentence of his book. I love that. And he says, once we truly know that life is difficult, once we truly understand and accept it, then life is no longer difficult, because once it's accepted, the fact is that life is difficult no longer matters because we're overcoming it. But we've got to name these adverse things that happen so we can understand these early on. And Sarah, what I so appreciate about your work in bringing ACEs to our attention the way you are today and letting us know that we don't have to be defined by our number. Instead, with an understanding of it, we get to take control of where our story leads. We can heal, we can have and create corrective emotional experiences in our lives, and we can grow to reach our fullest potential, not dragged down or held down by or defined by the things that happen to us. So all that to say, I so appreciate you being here today. Thank you for being on our show. And it was a wonderful time with you.
Thank you so much.
It was great. Hey, I also want to thank you, our listeners, for dropping by and joining Sarah and me. It's always great to have you with us. Regarding our episode today, I want to remind you that it and its resources and all of our other episodes can be found on our webpage at triadhq.com/BHT. So check out our webpage, triadhq.com/BHT, and explore our archive of podcasts and other resource materials. Thanks again for being with us on the show, and we'll look forward to having you back with us next time on Behavioral Health Today.